is Coach Tess from HealthEversity, and today we are going to be focusing on modifiers. This series is going to be focusing on CPT modifiers for the CPC exam. So let's jump right into it. So this is the intro to modifiers, okay? So let's go with this presentation. Okay, so it is the CPC exam modifier. So this is my pages. It's going to be really colorful, okay? All right, so here we go. So CPT modifiers is a 2-digit code that is appended to the CPT code to indicate that a service or procedure has been altered for some reason, but it does not change the main definition of the code. So this 31500 is my favorite code. It's just an example. They don't go together. This is just my little example that I created, okay? The modifier further describes the service provided. So if you do 31500 or you do let's say breast mastectomy, and it's bilateral and they do it on both sides, they'll do the modifier 50. So the 50 is what is your modifier. So here, that's your modifier, okay? All right, so this session is only for educational use only. All right, CPT modifiers is appended to CPT and the HealthEversity level 2 codes. Now you see I have my highlighter, you see I have all these colors, is because of I try to study like a student or try to teach like a student to make it easier for you. Okay, so reported for specific circumstances and alterations to a procedure, service, or medical equipment without changing the definition of the code. So if you're using a bilateral procedure, the procedure does not change, but the modifier tells the story what is going on, okay? So it helps with documentation. Correct reporting of a medical services for reimbursement is the responsibility for physicians and medical suppliers. So these people have to put the right modifier. You as a coder have to double check to make sure the modifier is right, and if not, you query the provider. Okay, CPT modifiers. At times, a CPT code needs to be reported with the addition of a modifier. Modifiers give additional, remember the term, additional information when necessary about the CPT code to a third-party payer, insurance company, possibly, to ensure that claims are paid correctly. Okay, so make sure you double check your modifiers are correct. Let's move on. Where can we find these modifiers? It's inside the front cover of your CPT manual or the Appendix A. The Appendix A is in the CPT manual and it's around the back, okay, of the manual. So you check your CPT manual and this gives more definition, Appendix A. All right. Let's move on. The purposes of modifiers, why we use them, and here are some of the reasons. So a service of the procedure has both a technical, which is a TC, and a professional component, which is a PC. So PC is a modifier, and TC is a modifier. It don't necessarily mean it's just numbers. It can be alphabetical. It can be alphabetical modifiers, okay? A service or procedure was performed by more than one physicians, or it could be a surgical team. So that's what it is, tells a story. A service or procedure was performed in more than one locations, okay? Can be 2 locations in the hospital. One is oncology, one is something else for treatment for something, different locations. So they have to have that modifier to tell the story. So modifiers are used for various reasons. The service or procedure was taken more time right here, more time right here, right? To complete than routinely would occur. So you'll find that, so let's say procedure is 5 hours and they did 7 hours. They have to tell you why they did 7 hours, okay? Or 50 minutes and they did 60 minutes, they have to document why, okay? A service or procedure was reduced or increased. So how you say you're going to do a mastectomy and you just take off the areola? Why? So you reduce it down to that. So you need to, or they say they're going to take care of the areola and then they take off the whole breast. They have to tell you the reason. Okay, let's move on to the next page. Okay, modifiers are used for various reasons. Let's hear another one. An unusual event occurred during the procedure. Let's say the person blood pressure went all the way sky high and they have to stop. So they might have to stop during an unusual event, okay? And certain things start happening to the patient, so they have to stop, okay? And an accompanying or adjunctive procedure was performed. So everything has to be documented, all right? Here's some other ones. Only a part of the procedure was completed. So they did one section and then they have to stop, or they have to reschedule for another time, so it's only a part of the procedure. Or for example, they're going to work on the eye and they're doing the first stage and the second stage. This is what normally happens as well. Now you have bilateral procedures, so you're doing the procedure on the right and the same procedure on the left. Bilateral procedure was performed. A service or procedure was performed multiple times. So these are some of the reasons why we use modifiers. So now we are going to get into the meat of the matter and let us focus a lot more on CPT modifiers for the CPC exam. Talk to you soon. Guess what? We are now ready to begin the modifier series with modifier 22. Okay, so let's jump right into it. Modifier 22. Okay, modifier 22. Increase in procedural services. So you see mine is all marked up is because of how, students study, I study, and I just kind of used to highlight. So it's extended time, it took longer than normal, or extenuated circumstances. So extended time, why it took so long. Okay, so let's jump in some important parts of modified 22. The additional work must be significantly greater than normal. Do not report this modifier with an E&M code. Additional time alone does not justify the use. The documentation must be descriptive, so the doctor has to elaborate why they have to do this, why they have to do that, because that's how they get paid. A lot of the time it's caused by denials, or if somebody's getting audited, you have to have the correct information. Use before modifier 22, comparative to the normal time, right? And effort to performing a procedure to the actual time. So you have the normal time and what actual time it took place, and effort it takes to complete the procedure. So you have the normal time, the actual time, and the greater time than usual. See? So this is very, very important for modifier 22. Okay, let's go on now. Increased work should be justified. And let me move this up closer so you can see. In the operative report with a paragraph in the note that explained the substantial additional work and the reason for it. Okay, here's another one. Additional diagnosis codes are often warranted to support the increased circumstances. So let's look at this point right here. When possible, the appropriate diagnosis code that describe the circumstances supporting the use of the modifier should be included to validate medical necessity. So you have to make sure that this is correct, right? So you use the modifier 22. When you're using it, or you should say it should not be used to indicate that the specialist performed the procedure or services. Modifier 22 should not be used to indicate the surgery was performed on an emergency basis or in the middle of the night. Not. Okay, this is when you can use it. Modifier 22 should be used carefully and sparingly. All right, let's go into an example. And I wrote the answer right here, but you're going to go break it down a little bit more as to why, why we use the modifier and when it is used and how it is worded in a scenario. Okay, a radical abdominal hysterectomy with bilateral total pelvic lymphadenectomy and a para-aortic lymph node biopsy was performed on Peg Smith. The procedure took 50 minutes. So now they are telling you what procedure was performed. This is the procedure was performed, and the para-aortic lymph node biopsy was performed on who? Peg Smith. That's the name of the patient. The procedure took 50 minutes longer than normal because during the surgery, what happened? The patient experienced prolonged bleeding. So this is the code we're using, 58210, and we append the modifier 22. So that's it for modifier 22. Let's move on